And in your medical coverage, over 40 million men in America suffer from a prostate condition known as BPH, an ailment that occurs as men age.
That's right. Over 12 million of those men have searched for a urologist's help. Hannah Zettel is in studio this morning to explain how a new treatment is improving quality of life.
That's right, Lauren and Joe. That treatment is called UroLift. And here in Springfield, Dr. Barry Farber is one of the few practitioners that can complete that treatment under local anesthesia.
I just stay at home. I watch old movies and stuff like that.
Ben Chilcutt enjoys the simple things in life.
It's kind of a long story.
He now enjoys them even more since receiving a life-changing treatment.
I've had this problem, say, maybe 15 years or more. I would, get up 3, 4, 5, 6 times a night to go to the bathroom.
Chilcutt suffered from benign prostatic hyperplasia, or BPH.
You better believe it. I mean, that's one of the first things I looked for wherever I went, was where the bathroom was at.
A condition resulting from the enlargement of the prostate.
Well, when the prostate enlarges, it just encroaches and narrows that opening for the urine to pass through and just creates a blockage.
Dr. Barry Farber has been practicing urology for 41 years, improving the lives of patients like Chilcutt.
When I started as a resident in urology, the treatment for prostate enlargement symptoms like Ben had was either what we call watchful waiting or a TUR. There was no other choice.
The TUR Farber refers to is an operation that involves cutting out the prostate's extra tissue and was at one time the gold standard treatment for BPH until now.
It's just like difference between day and night. I mean, I can go do what I want to, go wherever, and I just...
Chilcutt's time lost urinating nearly every 30 minutes was restored thanks to a treatment called UroLift.
So this is, I don't use the word revolutionary very often, but it's definitely revolutionary in terms of the technology, and the outcomes are quite dramatic.
Rather than cutting, heating, or removing prostatic tissue, UroLift is minimally invasive and instead spreads the tissue apart.
Looks like a little boomerang.
Oh, I'm just nosy.
No, it's
well, you've got 6 of them in you, so you ought to know what they're like.
UroLift is recognized by the American Urologic Association and covered by Medicare. The one-time treatment saving patients time and money.
I mean, not only quality of life, I think if you look at the cost of care of a disease, I think it's going to impact that significantly.
Over 80,000 men across the world have seen the change UroLift can do. Chilcutt singing praises for them all.
All I can say is if you suffered the way I did, go see a doctor.
Symptoms of BPH include interrupted sleep, urinary problems, loss of productivity, depression, and decreased quality of life. Dr. Farber told me that because those symptoms are inconvenient rather than painful, some men ignore the problem when they could be improving it faster. UroLift is readily available here in the Springfield area, so talk to a urologist for more information.